A video version of the correction that I probably sent you by now. This is Saturday morning. I haven't received your papers yet. It's 10:30, but I would like to go through the correction in order to show you how this difficult subject that I gave you had to be exploited and explored and turned into a synthesis. So the subject was difficult, but I thought it was relevant considering what is going on at the moment. It's a real subject. It's not me who made that up. It's an official exam subject that was given to, I think it was E3A or something. So this is the type, unfortunately, of topic you might be given for the final exam, and usually students do not like this too much because you have to know a little bit about the US and the UK healthcare systems. What they did this time is they gave you explanations in each of the documents, each of the document. They gave you explanations about how it worked, how the two systems worked. So if you managed to understand what each of those documents was about, then you understood the difference between the US and the UK healthcare systems, hopefully. Right, so I'm going to go quickly through the main elements of each document. So I'm not going back to the text. I'm starting straight from my table, and I will then let you know how I organized my plan, and I'm going to go through the synthesis because there are a few bits and bobs that I would like to comment upon. So the first text was about the bottom line about the US and UK healthcare systems. The bottom line is that it's the basics, okay, the basis of those systems. So in the first paragraph, they told you that 70 years after its creation, the NHS is struggling to provide universal on-time services. The NHS is the National Health Service in the UK. It's the equivalent of the Social Security security that we get in France, and it's struggling, which means it has difficulties at the moment because you have to wait a long time to get services, right? So that's the opening statement in this article. The second paragraph was telling you that despite multiple setbacks, which means failures over the last 20 years, British citizens keep admiring their institution and are poised to increase their taxes in order to fund it. Now, when you are poised to do something, it means you are ready to do something. So to be ready to do something is to be poised to. That's a nice way to say this differently. So people are ready to pay more in order to help their social security because they have great admiration for their hospitals and for the doctors and the nurses and paramedics and hospital staff and whatever. Right, in the next paragraph, they tell you that the demonstrative support of the British for the NHS was interpreted by the US leader, Mr. Trump, as anti-universal coverage. What does that mean? It's very obscure and opaque. Anti-universal coverage. Universal coverage means that every single citizen can get some form of medical care, right? And for Donald Trump, the NHS, the British system, is a system that doesn't cover everyone. And he tries to explain why. And I have to be honest, either because I do not understand Donald Trump or because it was very obscure, the reason that he gives is very difficult to understand. He says, as the NHS is publicly funded, instead of forcing citizens to subscribe to a private insurance. Or you can say to subscribe a private, but I think we'll subscribe to a private insurance. I think you can say both. So the difference between the two systems is mentioned here already. The NHS is publicly funded. What does that mean? It means that every single citizen pays taxes and that the social security is paid for thanks to the taxes of people. In the US, the citizens have to subscribe, to a private insurance, which means that if you are rich enough, you can get access to a private insurance company, which will cover your medical costs if you need hospital. But if you are a low-income person, if you do not have money, if you're poor, and you cannot access a private insurance, then it means you have no insurance. So it's really strange that he says this, and he says that the NHS is anti-universal coverage, because it seems to be the opposite. But, well, so I let this aside because I thought it was a bit unclear in the text. In the fourth paragraph, British politicians supported the NHS funding system as it is costless to patients at the end of the chain. So very interesting. When you go to the doctor, when you go to the hospital in the UK, you do not have to pay at the end of the chain. You do not have to pay your doctor when you go and see them. You know how in France you have to pay, I think it's 23 euros when you go to the doctor, which you are paid, well, you are paid back for. You don't have to, you do not pay really because you are reimbursed. But in the UK, you do not even have to give the money in advance to be paid back later. You do not pay anything. When I lived in the UK, I didn't have to pay anything when I went to the doctor. So it's very cheap. It's a system that is paid by the taxes, and you don't have to put money forward. Now, the last paragraph, or actually penultimate, one before last. Some noticed that the UK, which means some people, noticed that the UK was spending much less than its US counterpart on its health coverage system. The NHS budget should be doubled up. So even though it's an expensive system, and they tell you at the beginning that they have they're struggling, the NHS, the money they spend on their social security is less than what the US is paying. Because what you have to understand is that when people pay with private insurance, the government is covering part of this insurance, is paying for part of it. That's when it becomes a bit complicated. The last paragraph, the question of universal coverage is raised, how much money should be given for the social security, who should get the money, what. So the last paragraph was really a series of questions as to what the system should be. In the second text, so that was the longest text, as you can see, the first paragraph told you that the US and the UK health systems stand at each end of the spectrum, which means that they are very different from one to the other. They're almost opposite. They are poles apart. They are so different that they're almost the opposites. Okay. The US health coverage is delivered through private companies, while the UK government provides for the service itself. So the US is privatized, but the UK is public. That's what it means. Second paragraph, the UK system seems to cover citizens more universally and fairly, as it is funded by a tax-based system, unlike the US system, whereby it's funded by less reliable private funding. If you rely on private company, a company can always go down. It can go bankrupt. So if you gave money to a private insurance company and it goes bust, and we say in English, so it goes bankrupt, all this money will be lost and you will not be covered. But if it's the state, thanks to taxes, which funds the system, then you know that the state will never lack any money. So it's more reassuring. It makes the UK health system much cheaper than other nations, especially the US. Actually, instead of having to pay for a private company, imagine that private companies they can decide on the cost and the prices of the insurance that they give you, but the state is regulating how much you can ask people. They don't want people to pay through the roof or to pay too much money for their social security. But if it's private companies can do whatever they want, right? So it's at the end of the day, the UK system is cheaper than in the US, for example. Now, the third paragraph, the major downside, so this was about the limits of the British system. The major downside of the British system is its lack of service provision or responsiveness, which means that if you want to go and see a specialist in the UK, you have to wait for a long time. So I will explain this a bit better. Far from enjoying extensive privately funded budgets, the UK budget is constricted, it's limited, and it's only delivering pressing services. So what does that mean? It means that the government decides where the money is going, and they decide that the money of the social security should be dedicated to urgent problems, people who have really emergencies to deal with. If you want to have plastic surgery, if you want to have a nose job, if you want to have something that is not essential to your life, that is not life-threatening, and it's just like using medicine to improve your physical appearance, or something that is not urgent anyway, then you will have to wait a long time in the UK, sometimes up to 2 years, because they want to dedicate all their services to what is pressing, which means to what is urgent. Therefore, casting aside less urgent procedures, casting aside means they are leaving aside. Okay, they're disregarding urgent procedures. It is less patient-based, flexible, and does not adjust to their needs. This means that if a patient wants a particular procedures, let's say, I don't know, I will imagine a crazy situation. Imagine someone is bald. Right? And someone wants to grow hair again. So they need a laser operation on their scalp to grow hair, right? This will require hospital equipment and doctors and specialists, and this costs money. So what the government says is that if a patient wants something particular to their need, or as I said, if someone wants to have a nose job, they want to have their nose done, they will have to wait because it's not what the patient wants, it's what is necessary for them. Right? So the system doesn't adjust to their needs. In the US, a lot of the money in hospitals is dedicated to very rich people who have their body revamped. For example, they have new teeth put in place, or they have plastic surgery, or all these things which are not essential to health. They're just ornamental surgery, right? They can ask for what they want because they use private companies in the US. So when you use a private company, you can ask anything you want to this private company. When it's the state which decides what you do with the money, the state says, no, we're not spending all our money on things which are not necessary to your health, right? So it's less patient-based, right? It's more what is necessary to the system. Now, the next paragraph, the English government is at the helm. To be at the helm to be directing. To be in charge. When you're at the helm, it's a nautical term. You know, on the boats, when you're at the helm, you're the person, you're the sailor, you're the captain in charge of directing the boat when you're at the helm. So the English government is at the helm of expenditure. It makes all decisions regarding reimbursement, salaries, and employs contract or, again, technological investments. So the government, because it's in charge of the money for the social security, decides on everything that concerns the medical world. So they decide which equipment to buy, they decide how much people should be paid, they decide how much patients should be paid. So they make all the decisions. As a result, therefore, the development of medical technology depends on the economic returns it might yield. Try to understand this sentence. For example, the government will not invest in medical technology that will only serve one person. Very sadly, if you suffer from an orphan disease, which means a disease that very few people have or suffer from, they will not invest in a technology that is dedicated to those very rare and uncommon cases because it costs a lot of money. The economic returns are not very important. If you invest in very cutting-edge technology, advanced technology for only a few people, then this money is wasted in a way because it will only cover a few people. But if you invest in medical technology that covers a very common disease, then your economic returns are more important. Okay? Next paragraph, as a result, some denounce the denial of treatment access destined to more expensive and less common or technological requiring diseases. So this is exactly what I've just explained. This idea that if your disease is less common or more expensive than others, then the government might decide not to operate on you. You will not have surgery if what you have is very too uncommon and requires a lot of money from the hospital. Right. The last paragraph, even though it might become necessary considering the high cost of their healthcare system, the US is fearful such a system might be implemented in their country. I used a concession because there's a paradox. The US is looking at what the UK is doing because they realize that they're spending a lot of money on hospitals. Because as private companies are giving people a lot of access to whatever they want medically, hospitals have to keep up. So the government has to give money, okay, for the hospitals to be equipped for this. So they think maybe we should do like the UK. But the problem is, if they do that like the UK, they are fearful, which means they're scared, that the UK system might become implemented in their country. And this is the problem they see. Indeed, were the government in charge of guideline medical investments and technologies, which means if, remember, we can replace if by were, if the government were in charge of guideline, which means directing medical investment and technologies, it would certainly ration the services provided to consumer patients. This is the risk of socialized system. This is once again what I've explained earlier. So I will try to make it a bit clearer for you. Remember that what I said, in the US, the patients are like consumers. They ask for what they want. It's not the doctors telling them what they should have. It's the patients who want to have surgery who ask for what they want because they pay private companies to do so. So they have all the privileges they want, right? If the UK system was used in the US, which means if the government was deciding where the money, guidelining or deciding where the money should go, then they would ration the services. They would say, no, you're not having plastic surgery, right? As a doctor, I think that it's not necessary for you to have it, so you will not have it. We need to use our hospital equipment for things that are really necessary for people. So that's why the US would like to adopt the UK system because it is cheaper, but at the same time they're quite scared because they think, oh, it's a socialized system, which means we won't have the choice. When you use the private sector, you have choice. And when you use what the government gives to everybody, government gives everybody the same thing, then you have no choice anymore. So basically, bear this in mind. When it's private, you have a choice. When it's socialized, you don't have a choice, okay, in the services you get. Now, the third document was all in green because it was an American discussing discussing the UK system. So an American looked at the UK, at the British system, and couldn't understand why some people were criticizing him, because in his view, he thinks that the system in Britain is much better than in his country, the US. So very quickly, the American journalist is baffled, which means he's surprised, at British complaints about their hospital waiting time, when compared to the US is fairly decent. In the US, you have to wait a long time to go to hospital, considering that everybody wants to have their own things. But even British people are complaining as well. But according to the American, the waiting time is less than in the US, so they shouldn't complain. 4 out of 5 patients may be diagnosed under 4 hours, which is not true anymore. It takes much longer than this, but I don't know where he got his figures from, but even in the UK you have to wait a long time. He reckons the British are dissatisfied with a perfectly well-functioning system. So this American journalist does not understand, why British people are complaining about their system when he thinks that it's perfectly fine. Now, second paragraph, unlike in the US, so contrary to the US, in the UK, it is the nurseries and doctors' offices appointing you a time slot, no matter how inconvenient that might be. I don't know if you understand this, but when you go to the doctor, you do not decide on when you go. It's the doctor telling you, I've got a time slot for your appointment on Tuesday at 4, and it's up to you to be available. If you have a job, if you're a student, you have to make sure you're here. You cannot choose when you go to the doctor. That's very strict. Okay, but that's the only way they can regulate the amount of people they have. Third paragraph, quite dissimilar to the US. So I tried to use another word to say quite unlike the US. So quite dissimilar to the US. The UK doctors' offices advise you to only use emergency services for major needs. If you don't have a major need for hospital, unless so, patients are advised to go and consult their GPs. A GP is a general practitioner. It's basically your family doctor. So most doctors, if you call the hospital, will tell you if this is not an emergency, you're not coming to hospital, you're going to see your regular doctor, okay, your GP. So it's a strict system in which they impose on people what they have to do. Now, next paragraph. The paperwork due to be sent to insurance companies in the US are terribly burdensome. Burdensome means it's very inconvenient. So in the US, when you go to the doctor, if you want to be paid back for the consultation, it's very inconvenient. You have to send a lot of papers. It requires a lot of time. It discourages people from doing it. Whereas in the UK, all you have to do is give a few indications about yourself. Doctors even remind you of appointments, which is uncommon in the US. So in the UK, they are in charge of sending all the paperwork to your insurance companies for you to be paid back. So you don't have so much to do to be paid back. So it's much better. Okay, so as you can see, the American journalist is underlining everything that is done in the UK, in order to optimize the system. So the patients do not have much to do about insurance. It's the medical system is taking this in charge, and the doctors are even sending you texts to remind you of your appointment so that you don't miss your appointment. In the US, it's not the case. So they're doing everything in order for the system to work. But at the end, different color because different ideas. The limit to this system is that the specialists are hard to get by in the UK because all the services are dedicated to emergencies. So waiting time can be excruciating if you suffer from a chronic illness. That's the limit of this system. It's very highly regulated. It's really trying hard to be as efficient as possible. But if you suffer from a disease that requires a specialist, let's say you've got skin problems, okay, you've got a chronic illness, you've got, I don't know, psoriasis, or you do have a skin problem. Okay, I don't know, you've got, your skin is peeling off your head, or I don't know, you need to see a dermatologist or a skin doctor. Unfortunately, this is not considered as an emergency. A chronic illness is something you live with all your life. So if you want to see a specialist, then you will have to wait for a very, very, very long time because it's not considered as an emergency. So the doctor will not see you first. Okay. And the last article was someone from Britain, because that was a British newspaper, criticizing the system, where it says Mr. Trump is partly correct about our NHS. So partly only, okay? The system is okay, but there are limitations. So first paragraph, the free at delivery principle, which means that patients do not pay for anything, implemented in the UK is very costly as allocated budgets are extortionate, partly due to the role of unions in demanding decent wages for their employees. So this British journalist thinks that the British system is expensive because the doctors have to be paid decent wages. All the hospital staff is asking for decent wages, okay? Especially through their unions. A union is a syndicate, and that's the reason why the British government has to organize the system so tightly and so strictly, is to make sure they have enough money to pay their employees, because their employees are asking for decent wages. Okay? It's a budget that outweighs other departments by much, and it generates a debt that future generations will have to pay for. So the journalist is very critical of how much we pay those people. He says that the budget that we dedicate to the Department of Health is too much. It's too heavy. Okay, the budget is too heavy, and the reason is because employees, because they use their syndicates, are asking for a lot of money to be paid. And he thinks as well that that's the reason why we have to restrict access to the hospital, is because those people have to be paid so much. Okay, so a very different perspective. And then the second part of this very short article, the journalist suggests a few policies that might help redress the budget, the NHS budget. So he suggests 3 things. First, that every time you go to the doctor as a patient, you pay. So he's opposed to this. He thinks that people should charge at every visit at the doctors. So that would limit the number of people who access doctors, because obviously, if you have to pay to go to the doctor, then maybe some people who are poor will not go anymore. So that's a very strange suggestion he's making. Now, second idea, limiting help to those who willingly hurt their health. So imagine someone smoking, This journalist is suggesting not helping those people because they have voluntarily hurt their health. So why should we help them and make them benefit from the system that is paid for by everybody when they consciously made a mistake? Right, so very strong view here. And the last one is making patients prove they need the health services to avoid sponges. You know what a sponge is? Sponge is what you use to do the dishes. A sponge, to scrub the dirt out. A sponge. When someone is a sponger, it means that it absorbs. Like a sponge absorbs the water. Now a sponge is absorbing the water. And when we say someone is a sponger, it means it absorbs the resources from the state. So sponges are people who benefit from the money of the state, but they do not give anything in return. So what he wants is people proving that they need health services. So you have to prove you're ill and that you need the hospital. Can you imagine? So in this last paragraph, the journalist was very harsh. He was very difficult, very heartless towards patients. He wants to make the system a bit more difficult to access to people. Right, so as you can see, I've already placed my colors and they are symbolized here. So everything that is in blue in this table concerns the difference between a liberal market, which is the US system, where you use the private sector, you use the private market to regulate the health system, versus the socialized system, which is the British system, in which the state is in charge of offering and providing for services of health. Now, I managed to select 3 different parts. The first one is different funding modes and its consequences. So I basically went back to the text and I looked at how different the two systems were. Then second, it's how cheaper that is for patients. Which system is cheaper for patients? It seems to be the British system, because patients do not have to pay for anything when they go to the doctor. And the power of unions. Obviously, if you live in a liberal market, you don't really care about the syndicates. But if you live in a socialized system, you have to be careful about the power of the syndicates of doctors and unions. So the difference between those two systems are listed in those 3 parts. The next one is, because I'm comparing, and I think your plan should be a comparative plan. So you're comparing the system, then you're comparing how patient-oriented that is, how helpful that is to patients. So let's compare again. And at the end, how fair are the two systems, and you're comparing. So in each part, A, B, C, you compare the two systems, but at different levels. So here we compare simply the systems, how they work. Now we compare how different that is for the patients. And at the end, we compare how just the two systems are. So when you use a comparative plan, you have to use the comparison in 3 different parts on 3 different aspects. So the second part, health on demand, as in the US, or optimizing consultations in the UK. So what difference does that make for the patient? Now, second point is the waiting time. So if you want to see a specialist or if you go to hospital, the waiting time is quite different. If you want to see a specialist in the US, it's very easy because it's private. So if you've got money, you go and look for a specialist and you do whatever you please with it. And you can see a specialist very, very fast if you've got a lot of money. Now, in the US, though, if you go to hospital, you wait for a long time because there are so many surgeries that are going on because people are asking for whatever they please, that it takes a long time to see a doctor at hospital. Now, in the UK, you can't see a specialist over a short period of time, but when you go to hospitals, apparently it's much faster. So it's the other way around, okay? There's an opposition here between the US and the UK. And the last point is patient-friendly, free and easy, because in the US, for example, is very patient friendly, where the doctor calls you to remind you that you've got an appointment. Then they tell you, they take in charge, your insurance companies. Whereas in the US, you have a lot of red tape. And when we say red tape, it means that you have a lot of administrative papers to fill in. Okay, so it's very red tapey. I made an adjective out of this. Okay, it's very inconvenient. So how patient-friendly are the two systems? You will compare, once again, the UK system here and the US system here. And the last part is, in terms of justice, in this system, how just is it? You can compare the two. So universal coverage is charged. In the US, you have to pay for it. Everybody can get access, but you have to pay for it. Whereas in the UK, you don't pay for it. Well, actually, if you're a taxpayer, you do pay, but you don't pay when you go to the doctor. Discriminating patients, so between those who have chronic illnesses and those who have emergencies, how fair that is. They tell you that those who suffer from chronic illnesses, unfortunately, will not easily see specialists in the UK. So how fair that is. Because when you suffer from chronic illness, it's not your fault either. So do you have, or should you have to wait a long time? How fair that is. And investment in specialists, this last part was about how you decide to spend the money on the medical system and the specialists, okay? So that was mainly this part as well. So what can be done, how fair that is to say we're not going to help those who have voluntarily damaged their health, for example. Okay? How fair that is. So you will understand better this plan once you see it at work in this very long synthesis. For the title, well, actually, the title comes after the key question. The first thing you need to find is the key question. It was a very simple one here. It was a comparative plan. So how do the UK and the US compare in terms of fair universal health coverage? Okay, so it was just a comparative question. How different or how similar are the systems between the US and the UK? In terms of health system. Once I have my key question, I tried to use a play on word, a pun, saying giving a new lease of life to healthcare systems. So healthcare systems covers both the UK and the US because I added an S at the end. And to give a new lease of life to somebody is giving someone a second chance, to give a second life to somebody, basically. Okay, to give someone, to boost someone's immune system almost. So I tried to make a bit of a pun here. So that means that we're trying to improve the healthcare systems in both countries. Okay? Right, so I'm not going to spend too much time on the introduction because it's fairly usual. I start with a general statement here. So consulting medical services is inevitable at some point, and an increasing population requires growing efficiency in the delivering of health acts. So here I'm just saying that as there are more and more people on this planet, more and more people need medical services. That's why sometimes they are pressed or hard pressed to deliver services and to make sure everybody gets access. Now, as per usual, I present the sources, the set of documents comprising 4 British and American sourced articles dating from the last 2 years. So see what I'm doing here is I'm not spending too much time presenting the documents. I'm just saying they come from British and American newspapers and they are very recent because they date back from the last 2 years. Now, the key question offers a comparative study of the UK and US healthcare system or health system. It was not a very difficult one, to be honest. It's not a difficult key question you had to find. And here is my plan. So while comparing and contrasting both health coverages, the documents shed light on the differences between a liberal market-oriented process and a tightly socialized one. So this is the first part. Okay, I'm comparing, while questioning how patient-oriented and how fair it is. So see, this question of comparing and contrasting will be covering different aspects. First, how it works, then how patient-oriented that is, and then how fair it is. So, I always start my paragraph with the first sentence that tells me what I will talk about, okay, or what I will develop. The polarized British and American health funding structures are at loggerheads. To be at loggerheads means to be completely apart, to be completely opposite. In that means in the sense that the former, when I say the former, what do I refer to? I refer to the first element of the sentence, which is British. So the former provides and raises money to finance its medical services, while the latter is the second part of the sentence I've mentioned, American. The American system relies on private outsourced companies to cope with insurance and investment in the medical sector. So I hope you understand this former and latter. It's to make a reference to what was mentioned in the previous part of the sentence, and the former refers to the first part that was mentioned and the latter to the second part. If you have any questions regarding this, just get in touch with me and I can explain again. Now, so I carry on my explanation. The British organisation seems to favour cheaper access to care as it follows a free at delivery principle, according to which, so I'm explaining what the free delivering principle is, according to which patients do not have to pay for anything when consulting a doctor. Okay. Now, in terms of budget, so I've explained how it works. Now I explain the budget. In terms of budget, as the government is in charge of the health department, it restricts the amount of money subsidized by tax levies, since it responds to unions' pressure to grant decent salaries to its medical employees. So I'm explaining that the government is restricting the money to the system, or at least it's optimizing the way it uses money in order to pay decently its medical employees. It incidentally determines how much they invest in medical technologies, the fate of which depends on the return on their economic yields. This is what we explained here. So they only invest in things, where was it? I can't remember what it was. So they only dedicate money to the technology, medical technology, that will serve as many people as possible. And I continue, yet I want to show a contrast. The amount of money raised by the private US companies generates far more income in cash, thus more varied services to patients. So already I'm stressing the difference between the two systems. In the UK, they try to very strongly regulate how much money they dedicate to what. But in the US, because a lot of money can pay as much as they want for anything they want, there's a lot of money that is given to US companies. And they get a lot of money and they can offer varied services to patients. If someone wants to have a special surgery to get blue eyes instead of green eyes, they can do so. Okay, so the fact that people can choose in the private sector what they pay for offers a more varied service than in the UK, where you are given what you need and that's it. Okay, second paragraph. While sitting at each end of the spectrum, which means while we have a look at these two very different versions of the health system in the UK and the US, it is worth wondering how patient-oriented those two setups are. So my first sentence indicates that I will develop this idea. Okay? While the US may offer health on demand means you demand something, you get it. Yeah? To increasingly consumer patients who require treatments or surgery deemed as non-urgent, the UK seeks to optimize its consultations by reminding its patients not to resort to emergency services in case of minor ailments or disease or chronic diseases, but also by sending them texts so that they might not forget their appointment, and by cutting red tape upon arrival at the doctor's office. So I'm explaining here how, yes, indeed, you cannot demand whatever you want from the British health system, but they're trying to optimize everything. And I explain how they optimize everything, okay? They make sure you get the appointment on time. They make sure You only use hospital services when it's necessary for urgent emergencies, by helping you with your administrative papers. So they're trying to make it simpler for the users. The downside of such stringent means strict. The downside of such stringent services, so I'm still talking obviously about the UK, is the lack of resources regarding specialized conditions, due to which, or because of which, it might take up to 20 weeks to meet a physician. So obviously this system, if we compare it to the US, is less user-friendly, because if you suffer from a specialized condition, then you don't see specialists very fast. Conversely, easy as it might be to get a specialist appointment in the US, waiting time in the ER are emergencies. Emergency rooms are far longer than those of the UK, yet deemed by the British mainstream press as scandalous. So here I'm talking about what I've mentioned earlier. It's easier to see a specialist in the US, but when you go to hospital, to the emergency rooms, then it's longer for you to see a doctor. And it's the opposite in the UK. You cannot see a specialist very easily, but when you go to hospital, you get access to doctors faster. Okay? I even mentioned that for British people, apparently this is long. Remember, British complain about the time. And I mentioned this in this sentence when I said, yet deemed by the British, or considered by the British mainstream press as scandalous. Okay. The last paragraph is about how fair the system is. So beyond the contrastive outlook on healthcare on both sides of the pond means both sides of the Atlantic. The pond in the press is another word for the Atlantic. Okay. So on both sides of the Atlantic, which means in the UK and in the US. Okay. So when we look further, if we elevate the debate from just contrasting what is going on in one healthcare system, what is going on in the other healthcare system, so beyond this comparison lies the efficiency and fairness of each scheme or project. It goes without saying that by centralising the money allotted to medical services, the UK government might offer a guideline and redress the unfair access to care by providing free universal coverage, thus, or as a result, meeting criteria of affordability to all patients, whatever their means. So here I'm trying to list all the reasons why the UK seems to be a fairer or a more just system than the US, because they're trying to make sure all patients can get access to doctors without paying, that it's affordable to patients, that everybody is covered, free universal coverage, right. But by contrast, so we're contrasting this with the US system. By relying on privatization, the US coerces is the same to coerce, is the same as to force or to impose. Okay? So the US forces or coerces its citizens to take out private medical insurance, which is not all denizens can bear the expense of. So it's a complicated, advanced structure in terms of sentence, but which means not all a citizen or a denizen is a very archaic and formal word for citizens. So not all citizens can afford to bear the expense of, means to afford. Okay? To bear the expense of means to afford. Not all citizens can afford to subscribe a private medical insurance. Okay? So it seems to be unfair. But the high running costs of Medicare, that's the name of their social security in the US, is driving the government to glance at the British system of service rationing. So even though the US do not like this service rationing, they don't like rationing the medical services they offer people, they think that it's cheaper because what they have to pay for to make sure they can provide all the services that private companies promise the people who subscribe these insurances is very expensive. So they think, we don't like rationing, but it might be an idea. For Ranmore from The Independent, so remember that's the journalist here, the last document. For Ranmore from The Independent, the UK itself has to rationalise its budget by discriminating patients according to their needs, their respect for a healthy lifestyle, and charging visits to their GPs. So I have basically rephrased those three parts. Discriminating patients, okay, here. So those who really, really need health services and those who don't. Okay. Depending on their lifestyle. So if you smoke, well, game over for you. You don't get access to health coverage, and making people pay. Okay, so these the three suggestions he makes are here. Okay, they're rephrased in this part of the paragraph. Right, so I've tried to show how fair that is in this paragraph by contrasting the two systems. Now, what I did is I tried, you're going to tell me what you think about this, I tried to use a pun or a play on words to conclude my paper so that the examiner thinks, oh, this student is very funny. So I used this term, a shot in the arm. A shot in the arm is a phrase in English we use to say a stimulus. You want to stimulate something. You need to encourage something. And this is a medical term because a shot in the arm is like when you get jabbed or you get an injection from the doctor. So a shot in the arm is required or is needed to overhaul. Overhaul means to reform and offer sustainable medical services in both countries. What I'm saying is that it's necessary both for the UK and the US to reform their health systems if they want to survive. Okay? So a stimulus or a shot in the arm is needed. And I use this phrase, which is a medical term, say just what the doctor ordered. It's a phrase in English that means just what is needed. So for example, if I feel tired and you bring me a cup of coffee, I'm going to say, oh, just what the doctor ordered, which means just what I needed right now. Okay, so it is just what is needed right now for those medical systems, both in the UK and the US, is a shot in the arm. It's a boost. It's a stimulus. So depending on which side you're on, you either socialize the system or you privatize the system or you make it more difficult, as what this journalist is suggesting. But you're trying to stimulate the system in order to make it more efficient. It was not an easy subject. What I will evaluate in your papers later on in the day is how you manage to organize your ideas. I will not penalize you if you do not understand everything, but at least if it's coordinated and structured, this is what I will try to bonify in your papers.